media, all my dearest colleagues and the seniors, and the integrated of Apollo Hospital Navi Mumbai and the Gastroenterology Hospital. On behalf of Apollo Hospital Navi Mumbai, I would like to welcome you all again for the opening of a dedicated liver intensive care unit over here. In this brief presentation, I would like to take you through the journey of the thought process behind the creation of a liver-focused critical care unit in Apollo Hospital, Navi Mumbai. Let's first understand the spectrum and the burden of the liver diseases in India. The liver disease, if you talk about the spectrum of the liver disease, it is basically categorized into three broad categories. One is, first is the acute liver failure, where the liver per se is, there is no long-standing problem in the liver, but the patient suffers from some acute illness because of some infections or because of some toxins, where the liver function gets deteriorated and patient suffers from some illness. Chronic liver disease are the condition where liver gets structurally damaged because of some conditions, and there is a condition called acute and chronic liver failure, where there is a pre-existing chronic liver disease, but the liver function gets acutely deteriorated because of certain issues. The chronic liver disease, the majority cause of chronic liver disease in India is alcohol, almost 50 to 60% of cases. But in last decade, we have seen an increasing rise in the trend of the metabolic factor associated liver disease, which are mostly associated with rising trend in diabetes, dyslipidemia, and the lifestyle changes that happen in India. And as per the Union Minister, the metabolic associated liver disease is currently undergoing a silent epidemic in India. Coming to the burden of the liver disease in India is witnessing a rising mortality from the liver disease in India. Currently at present, it is very surprising to understand that liver disease features as a kind of one of the top 10 mortalities in India, which was not the case even 20 years back. So the burden of the impact of the liver disease is increasing day by day in India. So the entire management of the liver disease. One of the major problems of the patients suffering from the liver disease are that it is not a singular problem. They are often associated with multiple organ involvement and the multiple organ dysfunction. And it has been found that the number of the organ dysfunctions are directly correlated to the mortality. So management of the liver disease per se becomes entirely complex, and it always requires an approach which is a multidisciplinary approach and which requires binding with different other departments at the same point of time. Intensive care unit plays a major role in providing organ support for all patients who are suffering from the liver disease whenever they fails, and it also provides an cohesive unit for all other departments, and it acts as a binder with all other departments whenever they suffer from the liver disease. Now, the next question is, why do we need to have a dedicated liver ICU for the management of the acute and chronic liver failure or in the patients with liver disease? It has been found that two important reasons for it. First important thing, it has been found a dedicated kind of care always improves outcome. Whenever it has been proven in the various statistical analysis also from India, from the abroad, that whenever we do a focused kind of care, it improves outcome, and dedicated medical liver unit, it decreases mortality by more than 10% in all across the world. Along with that, a dedicated liver unit provides an umbrella care for entire patients with the liver disease. For any patients with the liver disease, they come to an institution, get the treatment done with a multidisciplinary approach, taking care. They don't need to bother to roam around in multiple places for the different treatment. So that is one of the major function that might play with the dedicated liver unit. The Apollo Hospital of Mumbai has we have planned to launch a dedicated liver unit over here, which will provide this kind of multidisciplinary care in a singular unit. What sets the liver unit in the Apollo Hospital apart is that we always use various advanced form of technology like various forms of artificial liver assist devices, various forms of particulars verified filtration devices, double filtration transactions devices, which are almost not available for most of the centers all around India. Other than that, Apollo hospitals, intensive care unit has always played a role to maintain a standard of care, quality care, which care which at par the standard or latest evidence of literature to maintain the certain standard. If you look at the structure of the AHNM liver unit, it's a dedicated 12-bedded liver ICU. So in this ICU, there is a round-the-clock availability of the intensivist, which are qualified with the degrees in the critical care medicines after their post-graduations. A team of sisters who take care of the patients, who are highly qualified and motivated to take care of the patients with complex medical problems. As we have said, we always tend to use a lot of extra-complicated liver assist devices, which are almost unknown, and there are a lot of blood purification devices, which are almost unknown for most of the centers in India. And we have a strong transplantation backup in our unit. So this is one of the functions of the Apollo liver ICU, one of the functions of the liver ICU, that will bridge the gap between the medical care of the liver patients and the surgical care of the liver patients, and anyone who requires a transplant at any point of time in their life during the process of the liver disease, they can get it to the same institution. So far, if you see the data of the transplant statistics, we have done almost more than 100 liver transplants in 1 year, and among them, almost more than 50 were the pediatric liver transplant units. So this is our liver transplant team in Apollo Hospital, Navi Mumbai. So there are few success stories over here. So this is the first patient. There are acute liver failure patients who only required a medical liver unit, who never required a transplant. He got better. So that shows the strength of the ICU of this hospital. To aim, and then to hand over the to the surgery.